Okay, now we're going to look at the muscles of the posterior forearm. In another video, we discussed the superficial muscles of the anterior forearm. Now we're going to be looking at the superficial muscles of the posterior forearm. So if we get ourselves oriented, here is the deltoid. You have an anterior deltoid, middle deltoid, and the posterior deltoid. Here's the biceps brachii, brachialis, and the triceps brachii. Now, the brachialis is a muscle that can flex the elbow, as does the biceps brachii, but the brachialis flexes the elbow and it's strongest in its pronated position. So the biceps brachii can flex the elbow in a supinated position. The brachioradialis can flex the elbow in a handshaking position, which is neutral. And the brachialis can pronate the forearm in a pronated position. Okay, so you have biceps brachii, brachialis, and this one here called the brachioradialis. Those are your three elbow flexors. Biceps brachii flexes in the supinated position, brachialis in the pronated position, and the brachioradialis flexes the elbow in a neutral position, the handshaking muscle, the politician muscle. Okay, now on the anterior forearm, in a previous video, we spoke about the muscles of the anterior forearm. We talked about the pronator teres, the flexor carpi radialis, the flexor carpi ulnaris, and the palmaris longus. So now we're going to look at the antagonistic muscles. So if there's a flexor carpi ulnaris, there has to be an extensor carpi ulnaris. If there was a flexor carpi radialis, there has to be an extensor carpi radialis. Remember, the flexors are on the anterior forearm, which means the extensors have to be on the posterior forearm. Okay. The flexors of the forearm, right, those superficial muscles, the flexors of the wrist originated on the medial epicondyle, whereas all of the extensors are going to originate on the lateral epicondyle of the humerus. So everything's opposites, right? So all the wrist flexors, like flexor carpi radialis, flexor carpi ulnaris, palmaris longus, and we'll throw in the pronator teres, they're going to have a common origin, and that's on the medial epicondyle. Again, those are the muscles of the anterior forearm. The muscles of the posterior forearm, all of these extensors are going to originate off the lateral epicondyle of the humerus. Now, on the flexor side, there was a flexor carpi radialis. So on the extensor side, there's going to be an extensor carpi radialis, but with a unique twist. There's an extensor carpi radialis brevis, if it has a shorter tendon, and an extensor carpi radialis longus has a longer tendon. Okay, but they all have that common attachment, the origin at the lateral epicondyle. And these three, we call the mobile wad of three, 1, 2, 3, because when you pinch your forearm on the lateral side, what you're pinching are these three muscles, 1, 2, 3. So when you pinch your forearm, the three muscles that you can grab are the ECRB, the ECRL, and the brachioradialis. Okay. Now we have an extensor digitorum. If we look in, let me zoom in on it. Here's the extensor digitorum. If we follow it, it runs deep to this ligament. Well, let's think back. What ligament did we have on the anterior wrist? It had a few names. it was the transverse carpal ligament, volar ligament, or the flexor retinaculum. And its primary function was to hold down all of the flexor tendons. Well, on the posterior side, we have the extensor retinaculum. And the extensor retinaculum, its job is to hold down all of these extensor tendons that we see here. Everything that's going to the thumb, all these that are going to the digits. But if we look at the extensor digitorum, it's going to go to digits 2, 3, 4, and it's going to have a little bit of an extension here to the 5th, okay? But the 5th really is unique because it's going to have its own. It's going to have its own little extensor called the extensor digiti minimi, okay, which is this one right here. Doesn't look like it's labeled, but if we follow it down, it only goes to the pinky. The pinky is called a digiti minimi, so it's an extensor digiti minimi, an extensor digiti minimi. So this is the extensor digitorum, goes to digits 2, 3, and 4. Okay, a little bit branching to the 5th, but the 5th really has its own an extensor digiti minimi. When we look down a little bit more distal, the thumb, which is called pollicis, right? Pollicis. The thumb is going to have some unique short muscles here. One is called the extensor pollicis brevis. Now, if there's an extensor pollicis brevis, there's going to be an extensor pollicis longus. There's also an abductor pollicis longus. And if there's an abductor pollicis longus, there's going to be an abductor pollicis brevis. But here's the extensor pollicis brevis and an abductor pollicis longus. Okay, let's take a look, a close-up of the muscles that we just covered, a little bit of a better, clear image that I can zoom in on here. So here's the mobile wad of 3, brachioradialis, extensor carpi radialis longus, and extensor carpi radialis brevis. Here's the extensor digitorum. If we follow it, it goes deep to the extensor retinaculum. We could see going clearly to digits 2, 3, and 4. This one here is the extensor digiti minimi. Extensor digiti minimi. All the way more medial is the extensor carpi ulnaris. Now there was a flexor carpi ulnaris. There's an extensor carpi ulnaris. It's on the posterior side, so it's an extensor. It crosses the carpals, so it's a carpi, and it's on the pinky side, which is where the ulnar is. It's an extensor carpi ulnaris. Down here on the thumb side, you could feel this pretty easily. If you were to raise your thumb and do like a thumbs up sign, right here, there's going to be a depression at the proximal, right at the base of that first metacarpal. There's a depression that you can feel here. That depression that you can put your thumb in, you could see 2 tendons on both sides. That's called the anatomical snuff box. It's called the anatomical snuff box. In the olden days, people would put cocaine in there and snort cocaine from the anatomical snuff box, which is right here, right here. And the borders, the 2 tendons that make that up, is this one here the extensor pollicis longus. It's got a long tendon. And then it's the extensor pollicis brevis. So you have the abductor pollicis longus, an extensor pollicis brevis. It's a shorter tendon in relationship to the extensor pollicis longus. So what's the extensor pollicis longus and extensor pollicis brevis going to do? It's going to extend the thumb. I mean, the action is in the name of the muscles. So some of these are kind of easy if you're asked for their actions. Okay. Again, all of these extensors are going to originate on the lateral epicondyle. Everything up here is going to originate here on the lateral epicondyle. Not these, obviously. I mean, these finger muscles and the thumb muscles don't originate up here at the elbow. Okay. Now, let's take a look, because this is a really nice picture here that's looking at, here's the olecranon process of the elbow. And here's the palm of the hand, and here's the pinky. So we're seeing a little bit of the anterior forearm, and we're seeing a little bit of the posterior forearm. So we're seeing a little bit of the flexor carpi ulnaris, if we look at it, flexor carpi ulnaris on the anterior side. And then on the posterior side is the extensor carpi ulnaris. Okay, and then even more posterior is the extensor digitorum. Now, if I were to ask the palmaris longus, I'm not going to give you this view. It's kind of, this would be very difficult. If I'm asking the palmaris longus, it's really going to be looking at the forearm from the anterior. But this just kind of, I like this for the FCU and the ECU to show the relationship of anterior and posterior muscles, agonist and antagonist. And again, medial epicondyle for flexors, lateral epicondyle for extensors. And to review the anterior forearm again, pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. These are all anterior forearm muscles. They're going to act on the wrist. They originate on the medial epicondyle. And then here's the brachio radialis. There's your flexor retinaculum. And you could see palmaris longus is the only one that's superficial to the flexor retinaculum or transverse carpal ligament or volar ligament. Now, it leads to a question, what's deep? What muscle is this that's deep, right? Because I refer to these as superficial muscles. So what's this deep one? This largest muscle, this happens to be the largest muscle of the forearms anterior. We could see it from here, we see it here, and we see it here. This is the belly of the muscle, and it's going to go underneath the retinaculum, and it's going to go to the finger flexors. Okay, it's called the flexor digitorum superficialis. Flexor digitorum superficialis. I'm going to show that in another picture. Let's make sure we covered these.